All right, welcome to this most recent episode of the Akkad and Coco Report. Today we have the pleasure and honor of having Dr. Manny Sethi here. Dr. Manny Sethi is a trauma surgeon, but is at the moment most famous for being a candidate for Senator of Tennessee. He's been endorsed by a number of incredibly prominent folks. Not a day goes by on Twitter that I don't see someone else endorsing him. I think the other day I saw Ted Cruz giving him a glowing endorsement. So we're incredibly happy to have Manny on to tell us about his story. Manny's a trauma surgeon, and I thought it'd be great to hear a little bit about his story and with regards to how he got to where he is right now. So, Manny, take it away. Tell us how did you end up as a trauma surgeon running for Senator of Tennessee?
Well, thank you. You know, my story begins like so many of ours. My parents were immigrants. They grew up in Punjab before the partition, and they're in sectarian violence. Their homes were burned to the ground in the early 40s, and then they moved to New Delhi, and very difficult circumstances for them. They grew up and both pulled themselves up by their own bootstraps to become doctors. Came to this country in the 1970s looking for a better way of life for their unborn kids, and retrained as doctors in Cleveland, and that's where I was born. When I was 4, we came to rural Tennessee, where I grew up and was raised my whole life. And they were doctors in the small town of farmers. And I watched that model growing up of community service, of watching them be engaged. Lost my dad when I was young. That really had a very powerful impact and influence on my life. Realized I wanted to become a doctor too. So pursued that journey. Along the way, I realized my passion to help folks who didn't have a lot, to be involved in their life. Really appreciated the intensity level, the decision-making in trauma that you need. And also, but at the same time, loved to help people who had been in harm's way. And that was just a natural sort of path to orthopedic trauma. So became a trauma surgeon, came home. And for the last 10 years, I've been at Vanderbilt, third busiest level 1 center in America, seeing patients. Meanwhile, created this nonprofit to give free care to patients across Tennessee called Healthy Tennessee. Very proud of that. We've testified before the Senate. President Trump has invited us to the White House. We've received so many accolades for the care that we've given, creating a new model of prevention. And now I'm running for the U.S. Senate to make a different kind of difference. I believe, you're called to help people. I've done that as a doctor. I've done that in my nonprofit work. And I just feel like it is a generational opportunity to make a difference here in Tennessee. And that's why I'm running.
Manny, you said you lost your father early. I'm sorry about that.
Sure.
Did you, was this when you were in college or high school or?
Right after I finished college, or in my early 20s.
And was that kind of your impetus to kind of go into medicine specifically?
Yeah, I had been heading down that path, but it really galvanized me to pursue medicine and to pursue surgery and to really make a difference in the world.
Did you find when you went into medicine, did you start practicing in an academic setting kind of right away out of fellowship, or?
I did. I came back to Vanderbilt for my trauma fellowship, and then I just rolled into being an attending. And it's such a crazy life. There's no training that can really prepare you to be an attending at a place like so busy. You just have to. You have to really. It's just a learning on the job, decision making, staying calm. Being comfortable making life and death calls, and just understanding, all that goes into it. And I feel very blessed and very fortunate to be able to do what I've done for the last decade.
Yeah, it's fantastic. You've been you're a trauma surgeon, which is more than a full-time job for a lot of folks. It's more than for most of the trauma surgeons I know, it's not quite a 40 hour 9-to-5 job. How did you get into politics? I mean,
well, I grew up in a family where my dad was always very politically involved. He was a very conservative person. And but what really, woke me up was when my father was in the last 6 months of his life, he was sued in a malpractice case. And it was really frivolous litigation. It was a patient who had cardiomyopathy, viral cardiomyopathy. And, the day he passed away, I was at a deposition. I made it in time to say goodbye to him. But it just led me to believe and understand that, physicians need to be more involved beyond the bedside. And that's not the time that I necessarily realized that I wanted to pursue this journey. But it was a time where I started to understand that physicians need to engage more in leadership. And just like my parents were leaders in their community, I feel like so many doctors in this day and age are so tunnel visioned by treating patients and just going home, forgetting about everything, not being civically involved. And I think it's so important that we get involved.
You mentioned that your father was very conservative. Is that where you get your conservative roots?
I think so. I mean, I grew up in a small town, and people pull themselves up by their own bootstraps, and very limited dependence on government, and those were kind of the principles I was raised with.
Is that unusual in the community of physicians that you're around?
Very much so. Very much so. Yeah, I'm surrounded by a lot of folks who think very differently about the role of the federal government than I do.
It's interesting because most physicians, I think, are skew fairly liberal, and so even in towns that are, or in states that are very conservative, the hospital, in those metro areas, I find a lot of physicians are very quiet about their politics because, you don't want to get eaten up for a variety of different reasons.
That's right.
I guess
right.
you never had that problem. You've been out front in a conservative.
Oh no, the attacks are starting to come, and that's just a part of life. And unfortunately, in politics in this day and age, people don't want to confront you or have face-to-face discussions. It's just not the way it is. And, in medicine, I think we need to do that more. I think for whatever reason, we don't do, in business, other areas, they do more team-based learning, team-based approaches. In medicine, we don't do that. And I think we need to be able to talk to each other about areas where we disagree, or, when you disagree clinically. And I just don't think physicians do that. And I think we need to really work on that as a profession.
Yeah. It's interesting. I grew up in a very liberal family, and my father is kind of like left of Che Guevara, so I come from a long line of, communists and atheists and stuff. So, and so I was actually a registered Democrat for the vast majority of my time that I've been in the U.S. And then, when I started a practice in 2013, a private practice, and I was actually a big believer in Obamacare. And I was like, look, we have these folks that aren't insured, and this will be a program to get them insurance. Because, I would look at my list every day, and, 20-30% of them wouldn't have insurance. So it seemed relatively straightforward that, hey, this seems like a good idea. And then, it got down to actually dealing with some of the nuts and bolts of what they were proposing. And I very quickly, that was, I think, my first little awakening to understand that, things aren't as simple as they make it seem. You can't wave a magic wand and say, oh, everyone has healthcare. Now, I've really modified, I think, my original positions quite a bit from where I started. Now, in your particular case, of course, you started as a conservative. Did you, when Obamacare was proposed, when it was starting to be implemented, were you pretty against it from the very start?
From the day one, I have always thought and knew Obamacare would be a disaster.
So how did you know that?
Because you could just see from the role that the federal government wanted to play, and knowing, I was a surgical resident at the time. You just knew what was coming. You knew that, getting government between a patient and their doctor was going to be a disaster. You knew that, the Washington establishment Republicans who own these lobbyists were just going to put money in the insurance companies' pockets to the detriment of patients and hospitals and providers. you could just feel it, with the electronic medical records, with it was just a disaster, man. It was too much change, too fast. And it was, it literally, I knew what it would do. It's killed rural healthcare in Tennessee. It's created this new era of, hospital employed physicians. It's just not what we need in American healthcare.
Yeah. Michelle, of course, is my ideologically well to the right of me, and it has been for much longer than me. Michelle, did you have the same feelings when the talk of the Affordable Care Act was going on?
Yeah, Obama. I mean, by then, it's funny. I sort of had a similar trajectory as you, Anish, in that I was, mostly left progressive until I experienced the realities. I worked for an HMO. And I started thinking that, it made sense, sort of an integrated system. You're going to ration care and whatnot, then you experience it, and then you sort of, you understand what the limitations are. So by then, when Obamacare came about, I had made my turn and my journey, and I could see that it'd be a real disaster. But that's Manny. I want to ask you a little bit. That's you think doctors should be involved in leadership, and but you're getting involved, so not locally, you're getting involved sort of at the federal level, and that's very commendable. I want to ask you, first of all, what is your impression of prior doctors? We have had U.S. senators that have been doctors and have been allegedly conservatives. What do you think? I mean, are they able to make much of a change? I mean, it's you're going to be confronting the swamp if you get elected, and what's your plan there? How do you approach this, or how do you think it's going to be different?
I mean, I think there are good people there, like Tom Coburn. He passed away recently. He was an incredible conservative OBGYN, very, very good. But I think the folks there now are too, I think they're like, I think Rand Paul is incredible. And he's one of the guys who's tried to take it head on and actually had a system that could potentially work. I think the other people are okay, but I don't think that the physicians in the Senate and the House have done enough to really try to repeal and replace Obamacare with a very clearly articulate plan.
So right. Your website, I just looked at it, briefly. It's very clear. At least, there's no mistaking you for, a liberal or somebody who's going to compromise on your principles. I mean, you have no qualms about it saying exactly where you stand, and I think that's very good. And I think if you were alluding to that, I think many of some not Rand Paul for sure, but some conservative or allegedly conservative senators, go there, MDs, and then they're corporatists, they want to tweak the system and they play the game with these things. But at the same time, it seems kind of daunting to, you have a population that's very much dependent on the system, right?
Yeah.
The Medicare population, there's many people who are dependent on health insurance, which is a huge scam. I mean, at least that's my view of it. I'm not sure what your view of health insurance is. How do you envision a transition? But maybe we shouldn't assume that healthcare is going to be a big focus if you get elected. Because I mean, you could be elected and you can be a conservative, and even though you're an MD, you may focus your attention on different things. But what are your thoughts on this?
Well, one of the biggest things I think we need to do is repeal and replace Obamacare. That's going to be one of the big things. And I think all of the points you're raising are important. I would say what we need is a truly free market-based healthcare plan. And one thing I think we need to think about is to allow employees of large companies, individuals and small businesses, more insurance options by deregulating the market. Right now we have 10 health insurance companies. They're empowered. They have a monopoly. They do what they want. They're in the lobbyists, they have the lobbyists, they have control, and they can do whatever they need. But what I believe is if we deregulate the market, we get government out of the way, we get rid of these essential health benefits in Obamacare, where a 90-year-old doesn't need to pay for maternal benefits and a 20-year-old doesn't need to pay for nursing home benefits. I believe we would flood the market with new products, new companies. We allow them to compete across state lines. We talk to all the state health insurance commissioners, let them do that. We make it tax deductible for individuals and small businesses. We allow large employers to give more flexibility to their employees to go to an individual market and purchase their own insurance if they so desire. I believe through doing that, you could have meaningful insurance reform. Premiums would go down, deductibles would go down. I think we need to re-incentivize the way we pay. I think in our country, we pay to treat disease and not promote wellness. So we focus on, management of end-stage diabetes or heart failure. We don't talk enough about pre-diabetic management or managing heart disease or hypertension early. And I think that if we did some of that in our healthcare system, we could really change. And I think the third component, though, and I applaud the president because he tried to do this with the hospitals, and that's that we need more pricing transparency. I think there's in any healthcare relationship, I like to say there are 3 Ps: the payer, the patient, the provider. And in American healthcare, none of those 3, the payer, the patient, the provider, any of the 3 Ps know what you're paying for. And without transparency, you can't have competition.
Manny, isn't part of the problem? So we kind of had somewhat of a expansion of the options that were available by kind of zeroing out the penalty for Obamacare, correct? So that's the one thing that kind of happened in a concrete way, was that instead of some penalty that you had to pay if you didn't buy an ACA plan, the mandate stayed, but the penalty became 0, which basically meant you had a lot of, a fair number of options that came about beyond just your ACA plans. And those were the short-term plans. Now the issue, of course, is that those plans, people are used to these kind of heavy, complete plans. And you have these short-term plans that are relatively skinny, that you don't pay much for, that have a higher deductible. You may understand all that. But, you had newspaper story after newspaper story of, they would find somebody who had a kidney stone or had some acute emergency. And, the fine print on the short-term disability said, yes, your deductible is $6,000, but if it's an observation, then your co-insurance, there are all these rules, right? It's so complicated, Manny, that they ended up with sizable amounts to pay, even beyond what their deductible. Some people, of course, didn't understand that they had that they had this large deductible as well. So it seems like the PR of it, the messaging of it becomes challenging. And it's always, maybe Michelle, you could also, either of you could weigh in and say, car insurance, we have lots of different options, right? And most of the products are pretty darn good, because if you don't offer a reasonably good product, they become extinct. Yet in healthcare, the consumer is constantly coming away kind of unhappy with whatever skinny insurance plans come out. Would you think, Manny, that you would need some type of regulations to say that, this is what you must cover X, Y, and Z, or how would you go about it?
Well, I don't really see a role for, I think, the moment you start regulating what people should cover and not cover, I think that's where we get into trouble. And that's why you've seen the failures with Obamacare. Right. I think, there should be a variation of products, of things, and we do that. And I think that, customers, people could get an insurance product they want. If that's catastrophic health insurance coverage, so be it. If that's a Cadillac plan, so be it. But I think you should have a range. Farm Bureau here in Tennessee, they're exempt from the Obamacare requirements, and they offer these kinds of different plans, and they're very successful. And I think they could be a model for other things. Also these healthcare cooperatives, they're exempt, these church cooperatives, and they're very successful. So I just think less regulation, more innovation, I think is what we need.
One of the things that, even if you do expand the insurance marketplace, I think one of the reasons that that this happened in the short-term market, because the issue is that you have all this fine print that results in what you're signing up for and what you actually get. They end up being different things. And part of what the struggle is that the providers are consolidated and are generating massive bills, right? And in order to keep those premiums low, there's a lot of cost sharing and cost shifting that's going on. So I think part of the problem is that you have, partly because of Obamacare, and Obamacare certainly accelerated that. You have massive consolidation of providers going on, which results in in a marketplace that's kind of screwed up in the sense that you don't have a ton of providers which are necessarily, able to lower the prices of goods. So if you go into the hospital for a kidney stone, you spend 30 hours there, no joke, you will come out with a $36,000 bill, which then is billed to somebody, and then hopefully someone is negotiating on your behalf, and getting that down. So how does one deal with what may be the biggest problem, which is provider consolidation and these provider oligopolies, if you will, that are kind of raising prices for the high ticket items that everyone is concerned about?
Yeah, it's a challenge. And I think, I think part of it is that, HHS is leading this thing now with hospitals of the master charge list. I think some of that will help, but I think pricing transparency in general will be very important to understand, what does a provider charge for X at this hospital? What does a provider charge for the same service at another hospital or the same zip code? Many years ago, I wrote this paper looking at the charges for a total knee replacement or some procedure in orthopedics in the same zip code, and it varied by like 180% in the same zip code. And I just think that's crazy because, like you said, there's a third party involved, the insurance companies that kind of negotiate and get in the middle of this. And that takes away from that free and fair market competition. And I just believe with pricing transparency, just publishing what we're charging for procedures, I believe we can do that now. This pooling of resources and large healthcare groups, you're right. That's a real challenge, but that's just something we're going to have to deal with.
Can you do anything about Medicare? That seems to be the most difficult piece of the puzzle here. Yeah, I mean, with it's always it's nearing. Perhaps, I mean, I haven't followed, but but it's always a strain on the budget, the trust fund, and all that.
Well, here's the thing about Medicare. First of all, there's so much waste, fraud, and abuse. I think that we need to really think about that, the administrative costs of Medicare. Again, we pay so much to treat disease. We're not getting on the front side talking about prevention. I think we could do so much better in Medicare. The quality that we're paying for in the hospitals, I think we should further regulate and better understand outcomes, value-based care. I think that's the future. I think there's so many ways to improve, to reduce cost, increase quality within Medicare. But the problem is it's such a behemoth system, and they've got all these people who are not physicians and are just bureaucrats that they don't understand. And I think that's what we need to start talking about is how do you effectively pay for prevention, and how do you deliver good value at a low cost, and how do you monitor that, right? Because that I think is the holy grail of Medicare is how do you measure quality? How do you pay for quality? How do you pay for prevention? And these are some of the things that I think we really need to challenge in the next decade when healthcare is 20% of our GDP.
What about letting letting Medicare patients choose? Have more choice in terms of if they want to go and opt out and go with direct primary care, or how do you get Medicare into I'm sure you've heard of the Surgery Center of Oklahoma. Is that Keith Smith?
Yes.
And his operation there. How do you kind of get Medicare some exposure to that system, right? Because
what I would say is a couple of, there's an idea called premium support, and that is that if you don't like your Medicare options, you should be able to get the money back from the federal government, go to the private market and get your own insurance. And that comes back to that individual insurance market I was talking about without the hand of government. It would allow you to have the same insurance package you had when you were 30 as when you were 80. You could just stay on it with the concept of premium support. And this Surgery Center in Oklahoma, it's interesting. There was a documentary that they did on that surgery center. And in fact, they included Healthy Tennessee in that same documentary. our nonprofit, and so I think it's a good, yeah. I agree with you.
Tell me a little bit more about Healthy Tennessee and what it's about, and how you
Well, we created Healthy Tennessee about 9 years ago. We traveled the state doing these health fairs. Started very small, then turned into a much bigger deal where we had 100 volunteers seeing 1,000 patients. We developed lab equipment, and sometimes we have mammogram ability and X-rays. There's just a whole variety of things that we were able to do.
That's great. And it's all free, or it's all just donated?
Free.
It's all okay.
It's all free. Private funding. We haven't taken a dime of government or state money, and I'm very, very proud of it. We've ventured into a lot of health policy. We've created some opioid policy and given the governor a white paper. We've done a lot.
One of your big planks is on the opioid crisis. What are your thoughts in terms of what created it, and what we can do to kind of stop it from a policy level?
In Tennessee, I think the opioid crisis is one of the biggest challenges and threats, specifically in rural Tennessee, in our urban centers too. And the problem is we have a one-size-fits-all solution that empowers the federal government and the state government, but really doesn't take advantage of empowering local communities, mayors and sheriffs. And I think, on a federal level, they're just pushing MAT down people's throat, medication-assisted treatment. Sometimes now they're doing more of the clinical psychology or that work to reduce the recidivism rates. But what I believe is that we need to empower local mayors, local sheriffs, people on the ground, because they know more about what's going on in their community, and that problems are different everywhere you go. And, I think some counties have a powerful drug coalition. I think drug coalitions are so important, and the federal government, instead of having this one size fits all thing, incentivize local counties to have drug coalitions to come up with their own solutions. But, I believe in faith-based recovery. I believe in the 12-step program. I think that these recovering folks, we need to get them meaningful jobs. There's a company called Homesteader in Claiborne County here. When you're recovering, they get you a meaningful job. You're building trailers. You're making money. I think it's a really good system.
Is this basically federally funded or state funded programs, or you would foresee this as churches and local community organizations?
Well, I think it should be public-private partnership. Because I don't think the federal government, we don't have the money to do all this, and I think this program at Homesteader could be very powerful. But right now what's happening is again, you've got this one size fits all federal money that's going to these states, and they say, okay, this is what you got to do. And there's no room for innovation or change.
All righty. Go ahead, Michelle. Sorry.
Yeah. So I don't know. I wanted to move maybe a little bit away from healthcare and sort of more generally, since you're going to be involved in, you would be involved in national politics if you get elected. First of all, related to the opioid crisis, what is your view on the drug wars and the war on drugs and the federal involvement in all of that? It seems, that one could make a conservative case that, there should be less, criminalization of drug use. That there's it creates a whole lot of gangs and cartels and whatnot. And what is your thought on that?
Well, my feeling is that first of all, if you sell these drugs and you peddle these drugs, you need to go to jail. And I believe these traffickers of high amounts of fentanyl and drugs like that should go to jail for the rest of their life, because I've seen it kill people. I've seen it kill children here in Tennessee. Now, the one thing I am concerned about is that, 80% of the folks who are in jail here in Tennessee, they, either the opioids or they have some drug problem. And I think recidivism rates are so high because we're not effectively helping those people. And so through drug courts, through, recovery programs, through getting them meaningful jobs, like I mentioned, these are the ways that I think we can really tackle this problem. But I think the jury's still out about how to deal and make meaningful criminal justice reform. But the one thing I can tell you is that the pushers of these drugs should pay the ultimate price.
And and then maybe a related question.
Sure.
Again, moving a little bit. So obviously, healthcare was a huge concern. Maybe a couple of years ago. Now it seems that it's taken a little bit of a backseat, except for the fact of the pandemic.
Mm-hmm.
But the most big preoccupation right now is how divided we are as a country. I mean,
yeah,
healthcare is a component of that, but we're really extremely divided. I mean, it's just very difficult to to understand, to see the path of reconciliation when people have such a radically different views and are very angry about either pro or against the federal government's involvement in their lives and all of that. So as a senator, how would you approach that problem, the problem of this huge division, which is ideological, cultural, spiritual, whatever you want to call it or frame it?
Well, I think that as a trauma surgeon, right, there's a lot of times where you have a minute, 2 minutes, you're in these like awful situations. You have to make life and death decisions, and you got to bring people around together around a table, in the operating room to do the right thing. And I think that gives me a very special ability or experience that I can bring to the table, to the Senate, to get people to kind of work together. And I think, I've got my principles. I'm very conservative, and but at the same time, we got to do the work of the people and get things done. And I think we got to get rid of these career politicians who just say do anything to get elected, and these Washington insiders. And I think if we can do that, I believe we can really make forward advancement. But I think a trauma surgeon in the Senate is someone who can get stuff done.
Excellent. What you have some pretty strong views on the Second Amendment as a trauma surgeon. Again, the most of the crowd of trauma surgeons think that if you're a trauma surgeon, you should be against the Second Amendment, or
Sure.
You should be for limiting the number of guns that are out there. What's your response to them?
Well, I stand firmly for the Second Amendment, and I don't think guns kill people. I think people kill people. And I've got a carry permit. I've got a Glock. I stand firmly for the Second Amendment, and I just don't think physicians should be involved. I just don't think that we should take care of those patients in our role as doctors. I don't think we have a role to talk about that. I mean, I think outside of that, as citizens, sure you do, but I just don't think it's the role of a physician to talk to you about your guns, or a pediatrician to talk about guns with a family. I just don't think that's right.
Yeah, it's interesting. Gun sales, with what's happened the last month or so, have just gone through the roof. Some crazy numbers, right? It's gone up. Gun sales have gone up 40%, and so it kind of seems like it's an interesting way to seed the argument on 2A.
Yeah,
it seems very hard at this point for anyone to be making much of an argument about that. What are your thoughts on the pandemic, and where's Tennessee heading when it comes to the pandemic?
Well, I think no matter what happens, we can't shut down. I think we got more cases. The cohort of people is like 18 to 40. Yeah. We still got room in our hospitals, our hospital beds, our ICUs. I think we just gotta be vigilant. I do think we need to go back to school. We need to get our kids back to school. We need to keep our economy open. We just need to get through this thing. I just don't think we should shut down again.
Yeah. Do you think that this is going to, in the end, help or hurt Donald Trump when it comes November time? Do you think it's going to be over by then? What does your crystal ball say?
I think this is here to stay for some time. Yeah. I think the president will win re-election. I think that these polls, I don't really put much faith in polls. Having said that, our own polls show us that we're doing very well. So I hate, but I don't put faith in, I think things can change.
Wonderful.
So.
Dr. Sethi, it's been fantastic to have
Thank
you. I
you.
know you're incredibly busy.
Thank you, guys.
It's great to see a fellow physician, trauma surgeon, a first generation immigrant, kind of making that leap to get to senator. Oh, I almost forgot to ask, would you be the first Indian senator?
American senator? That'd be right.
Wow, that would be awesome. That would be awesome.
Be amazing. And we're almost there. So you can go to drmannyforsenate.com. Please consider donating to the cause. We got 9 days. My opponent's launching attack ads left and right. But if we just can continue to get to the finish line, we're going to win.
Fantastic. Thank you so much for coming on.
Thank you. God bless. Thank you.
Yep.